This is your Diamond Insight of the continued jaw-dropping anomalies in the Ministry of Health. For a long time, the functions of the Zambia Medicines and Medical Supplies Agency ZAMSA have been marred in controversy and suspicious procurement, storage and distribution of medical kits worth millions of kwacha. This is why it is not surprising that containers of supplies imported from Mission Pharma in Egypt were allegedly stored at a named private facility, as if the government is ever short of capacity. It is upsetting that from 2022 into 2023, there was a shortage of medicines in health centers countrywide, a matter that put millions of helpless citizens at risk, and it was on that premise that sourcing of the Egyptian drugs was conceived. We are aware ZAMSA officials were part of a high-level visit to Egypt in a quest to end the shortage. One wonders why management at ZAMSA is allegedly unrepentant, because in 2022, its directors were asked by the board to exculpate themselves following damning anomalies when it was allegedly discovered that defective medical kits were distributed in public health facilities. The latest scam paints a picture of firm, invisible hands beyond ZAMSA that are profiting from the sick, and it is not surprising that both non- and serving health workers are even ripping apart the NEMA scheme, leading to a near collapse of the system that was designed to save lives. Suspending the ZAMSA top brass is a right step in determining the extent of the problem, and we challenge investigative wings to conduct a thorough assessment as to why 61 out of 73 containers were stored at a private warehouse. This chapter of alleged mass mismanagement is certainly testing the New Dawn administration's capacity in dealing with illegalities that have for years been institutionalized, and somewhat organized elements have been left to thrive because some beneficiaries are profiting from it. The Ministry of Health has a deep problem, and we wonder if the so-called integrity committees do function due to the rampant cases of suspicious mismanagement of resources. We demand a swift commission of inquiry. ZAMSA and its sister institutions need a breath of integrity and commitment to serve the interests of the country. Clearly, the level of suspicious happenings being unearthed in government goes to show loss of moral compass, paints a grim picture that the nation has few selfless civil servants called to serve. Without us appearing to act as judge and jury, we demand that the accurate findings be disclosed, why ZAMSA always finds itself in costly and questionable circumstances.